Lou Gehrig's disease is a progressive degenerative disease of the nervous system that kills its victims within 2 to 5 years of diagnosis.
Now, there is no cure, but our Dr. Max Gomez says that there may be hope with an experimental stem cell treatment.
This is what Lou Gehrig's disease looks like in advanced stages. Nerve cells in the brain and spinal cord slowly die off, leaving muscles paralyzed. Some patients develop weakness in arms or legs, others in chewing, speaking, swallowing. But eventually,
the weakness progresses and they die because of their inability to breathe, because those diaphragm muscles no longer can sustain their breathing.
Push. Ted Harada has ALS, the medical shorthand for Lou Gehrig's. First, his left leg got weak, then his arms and hands, and eventually he needed a cane to get around. He knew he had only a few years to live.
I could let it beat me now, or I could live every day and fight every day and live my life out to the fullest.
For Ted, that meant volunteering for an experimental stem cell treatment. He was one of 7 patients who had injections of neural stem cells derived from a fetus in 1991 and maintained in a lab ever since. 12 injections into the area of his lumbar spinal cord where his nerve cells were dying.
I appreciate it, buddy.
This is Ted meeting his neurosurgeon at Emory Hospital in Atlanta 8 months after his injections. Of the 7 patients in the trial, Ted is the one that actually got better.
I just feel like a different person. I have a lot more strength, a lot more stamina, and more energy.
Trouble is, this trial was just meant to show that the technique is safe, not to actually work.
I don't know why he's getting better. Maybe it's the cells. Maybe it's an epiphenomenon of the cells. Maybe it's something that is unique to him in terms of his interaction with this.
There are still lots of questions. Where and how many cells should be injected? At what stage of the disease? And how are they working? But for the first time, there's a glimmer of hope in a devastating disease. Dr. Max Gomez, CBS 2 News.
So